Hello everyone, in this video we will be reviewing the frequently asked questions about the urinary system. Urinary system is also known as renal system. It includes kidneys, ureters, bladder and urethra. Question number 1. The primary structural and functional unit of the kidney is the A. Renal medulla, B. Nephron, C. Renal pelvis, D. Glomerulus. Think the answer. The correct answer is B. Nephron. When you look at the kidney, you can see there are thousands of nephrons. The nephron is the microscopic functional unit of the kidney, responsible for the initial filtration of blood, subsequent processes of reabsorption and secretion to form urine. Question number 2. The loop of Henle is located in which structure? A. Bladder, B. Kidney, C. Urethra, D. Prostate. Think the answer. The correct answer is B. Kidney. As we seen earlier, you can see this is the nephron. That's the functional unit of kidney. On the nephron, you can see this is the loop of Henle. So the loop of Henle, also known as the nephron loop, is a hairpin-shaped structure that extends from the proximal convoluted tube and is a part of the nephron. The nephron is the microscopic functional unit of the kidney, responsible for filtering blood and forming urine. Question number 3. Urine is transported from the kidneys to the urinary bladder by which structure? A. Urethra, B. Ureter, C. Renal pelvis, D. Urinary vein. Think the answer. The correct answer is ureter. You can see the kidney is here. The urine produced in the kidney transported through the ureter to bladder. From the bladder, it's passing out through urethra. So the ureters are the muscular tubes that transport urine from the renal pelvis of the kidney down the urinary bladder. The urethra transport urine out of the bladder and the body. Question number 4. Which of the following best describes the structure that collects urine in the body? A. Bladder, B. Kidney, C. Ureter, D. Urethra. Think the answer. So here it asks for collecting urine. So collection of urine done by the bladder, but the production is done by the kidneys and it is stored or temporarily collected in the bladder. So the urinary bladder is a temporary reservoir for the storage and collection of urine. The kidneys produce urine and the ureters and urethra are transporting tubes. Question number 5. In men, which of the following structures is located at the neck of the bladder and surrounds the urethra? A. Epididymis, B. Prostate, C. Scrotum, D. Seminal vesicle. Think the answer. The correct answer is prostate. You can see on the male, just below the bladder, there's a gland called prostate. The prostate gland is an accessory gland of the male reproductive system that is situated directly inferior to the bladder and surround the initial portion of the urethra. That is called prostatic urethra. Question number 6. Which of the following describes the cluster of blood capillaries found in each nephron in the kidney? A. Efferent arteriole, B. Glomerulus, C. Loop of Henle, D. Renal pelvis. Think the answer. The correct answer is B. Glomerulus. You can see the glomerulus here in the nephron. The nephron, that is the kidney's functional unit, begins with the renal corpuscle, which consists of glomerulus. It's a dense cluster of fenestrated capillaries and its surrounding capsules. That's called Bowman's capsule. The glomerulus is the site where the initial filtration of blood occurs to start the process of urine formation. Question number 7. What is the result of a urethral blockage? A. Urine will not be able to flow from the kidney to the bladder. B. Urine will not be able to flow from the bladder to the urethra. C. Urine will not be able to flow from the bladder to the kidney. C. Urine will not be able to be voided but will be trapped in the bladder. Think the answer. So the correct answer is A. So in this question, you have to be very careful when you read this. This is urethral blockage, not urethra. So this is urethral blockage, not urethral blockage. So we have to be careful. So when the ureter is blocked, the urine from the kidney will not transfer to the bladder. So the correct answer is A. Urine will not be able to flow from the kidney to the bladder. Question number 8. The renal pyramids are located in which region of the kidney? A. Renal cortex, B. Renal pelvis, C. Renal medulla, D. Renal column. Think the answer. The correct answer is C. Renal medulla. So when you look at the pyramid, these are the pyramids. These are the striped cone-shaped areas in the inner part of the kidney are the renal pyramids which found in the renal medulla. You can see this is the medulla that consists of the renal pyramid. Question number 9. Which hormone is produced by the kidney in response to low blood oxygen levels to stimulate red blood cell production? A. Renin, B. Aldosterone, C. Erythropoietin, D. Calcitriol? Think the answer. The correct answer is C. Erythropoietin. When blood having low oxygen, it will stimulate the kidney and the liver. They are both produce the hormone called erythropoietin, but the major part is done by the kidney. So when the erythropoietin is released by the kidneys, that stimulate the bone marrow to produce red blood cells in response to tissue hypoxia. That is called low blood oxygen. Question number 10. The primary nitrogenous waste product excreted by the kidneys resulting from protein metabolism is A. Creatinine, B. Uric acid, C. Urea, D. Ammonia. Think the answer. The correct answer is C. Urea. Urea is the most abundant nitrogenous waste product in the urine, primarily formed in the liver from the breakdown of amino acids. Question number 11. Which part of the nephron is primarily responsible for water reabsorption? A. Proximal convoluted tubule, B. Loop of Henle, C. Distal convoluted tubule, D. Collecting duct. Think the answer. The correct answer is B. Loop of Henle. So in the nephron, you will have the loop of Henle. The descending limb of the loop of Henle allows water reabsorption, concentrating the filtrate. Question number 12. The renal arteries branch directly from which vessel? A. Inferior vena cava, B. Abdominal aorta, C. Superior mesenteric artery, D. Iliac artery. Think the answer. Correct answer is B. Abdominal aorta. When you see here, the abdominal aorta is divided into the left and right renal arteries, and the right and left renal veins are drained into the inferior vena cava. So the renal arteries arise from the abdominal aorta to supply blood to the kidney. Question number 13. In males, the urethra also serves which additional function? A. Filtration of blood, B. Secretion of hormones, C. Passage of semen, D. Storage of urine. Think the answer. The correct answer is C. Passage of semen. You can see there is a vesicle called seminal vesicle. It produces the semen. Semen consists of the sperms for the reproduction. So the male urethra serves as dual role in carrying both urine and semen, but not simultaneously. Question number 14. A patient with benign prostatic hyperplasia, BPH, will most likely to have difficulty with A. Kidney filtration, B. Urine storage in the bladder, C. Urine flow through the urethra, D. Urine formation in the nephron. Think the answer. The correct answer is C. Urine flow through the urethra. When you look at the male urinary system, immediately below the bladder there is a prostate gland. When the prostate gland enlarges, it blocks the passage of urethra. So the enlarged prostate compresses the prostatic urethra, hence it obstructed the voiding, that is passage of urine. Question number 15. Which urinary structure is shortest in females, increasing the UTI risk? A. Ureter, B. Urethra, C. Bladder, D. Renal pelvis. Think the answer. The correct answer is B. Urethra. When you compare the male and female urinary system, the female urethra is very short, but in the male urethra is long because it's passed through the penis. So the female urethra is only about 3 to 4 centimeter long compared to the male urethra, which is about 18 to 20 centimeter. Because of the short length and the proximity to the vagina and anus, bacteria, especially E. coli, can more easily ascend to the bladder, increasing risk of urinary tract infection in females. Question number 16. A patient has a stone lodged at the uretrovesical junction. Where is the blockage located? A. At the urethral sphincter, B. At the entry of the ureter into the bladder, C. At the renal pelvis, D. At the bladder neck. Think the answer. The correct answer is B. At the entry of the ureter into the bladder. So the ureterovaginal junction, you can see it is here. The ureterovaginal junction is where the ureter inserts into the bladder wall. So the correct answer is B. Bonus question. Which blood test best reflects kidney filtration function? A. Hematocrit, B. Serum creatinine, C. Hemoglobin, D. Platelet count. So think the answer and leave your answer in the comment section. If you have any question, please leave in the comment section. My channel offers guidance for the medical coding, especially to help you to prepare for the AAPC CPC examination. If you have any issues, please feel free to ask me. You can leave your questions in the comment sections, or you can email or WhatsApp me using the details displayed here. If you feel this channel is useful, please subscribe my channel and stay with me. Thank you.